Thank you for joining us for today's episode of the Women's Health and Fertility Podcast. My name is Dr. Tina Yang, and I'm the founder of Revive Chi Health and Fertility Center. Today's guest, Dr. Mary Alice Mina, is a Harvard trained dermatologist, international speaker, author, and the host of The Skin Reel, a top ranked and global podcast. As a co owner of Balcom and Mina Derm Surgery in Atlanta, Georgia, she is a leading expert in procedural dermatology, skin health, and skincare. With nearly 2 decades of clinical experience, Dr. Mina is celebrated for her artistic eye, surgical precision, and ability to help patients feel radiant at every stage of life. Dr. Mina delivers impactful keynotes and leads workshops and retreats focused on reframing aging, aesthetics, and skin health. Her insights have been featured in major media outlets, including People Magazine, The Wall Street Journal, Glamour, and the Huffington Post. Passionate about empowering others, Dr. Mina combines her expertise with practical advice to inspire audiences to embrace their unique beauty and live confidently in their skin. Well, hello and welcome, Dr. Mina, to the Women's Health and Fertility Podcast. I am so thrilled to have you on my podcast today as a guest. And I've been listening to your podcast for some time now. And what really caught my attention about your podcast was your emphasis on skin minimalism, pro aging versus anti aging, and timeless skincare for all ages and stages of life. So, I would love to hear more about your clinical background, your specialties, your practice passion, and anything else you'd like to share with us today.
Well, thank you so much for having me. I'm thrilled to be on here and I'm glad you're getting value from my podcast. I know your audience is as well with yours. So it's just, I think, such a cool way to share information and knowledge and
For
just
sure.
shows it makes the world a much smaller place, right? When we can just put information out and have a conversation. And I love talking about skin. And I think most women, I don't mean to just stereotype, but at least all the women I meet when they find out I'm a dermatologist, like, immediately I get questions. Oh, what should I
I'm
be
sure.
using? What do you use on your skin? Can you look
Right.
at this? Right. I just think our skin, it's front and center. It's the first thing people see when they're looking at you.
Mhm.
And it can really affect how we feel about ourselves. I know maybe it shouldn't, right? But it does. That's the reality. First impression, and how you see, and actually there have been studies shown like people with severe acne are judged as being less intelligent, someone
Mm.
you'd want to be you wouldn't want to be friends with. I mean, these are significant things and they can have um important impacts in someone's life. So I think there's a lot of interest in skin, and I just want to make sure I'm helping people get good information about skin because there's also a lot of nonsense out there.
Well, thank you so much for sharing your wisdom and your knowledge with us. And, I just love your approach that skin health is so much more than what you put on your skin. And it starts with how you take care of your body. And, being a natural medicine provider, that's really important for us. And we emphasize that a lot in our practice, that you kind of are what you eat. And, we can't just look at the external, but we need to focus on our internal selves as well. So, having the integration of the two is always best.
Oh yeah.
So, I would love to hear about what are and you probably hear this all the time, but what are some of the key steps for folks to follow in just maintaining an overall healthy skin regimen for any age, any stage of life?
Yeah, so it's pretty simple and pretty basic. And if you're a true minimalist, all you really need is a gentle cleanser. And you can use the same cleanser for your face and your body. You don't have to use
Mm,
two different ones. You need a sunscreen and you need a moisturizer. And that's really it. That's really all
mm,
you need. And it doesn't have to be more complicated than that. Some people, for me personally, my sunscreen up until about 40 was my moisturizer. That provided enough hydration for my skin,
sure.
typically depending on what season and things like that. So it really can be that simple. Now, for a lot of listeners or a lot of women, we maybe want a little bit more than that, right? I know I do. So I'm not, I guess, your most basic minimalist. I'm kind of in the middle. So I like to have a few extras. So
Mhm.
my number one extra is a retinoid, or retinol is the over counter over the counter version. I might also call it tretinoin because that's the prescription form. But I have been using this consistently. I started using it because I had acne when I was younger. And then I continued it into my 20s. I did stop when I was pregnant with my children. And then I have been back on it now for, a decade plus. So I really credit tretinoin as this powerful, beyond sunscreen. I would say it's really one of the most powerful skincare products we have out there. We have such good data to show that it increases cell turnover, it helps erase fine lines and wrinkles and discoloration on the skin, and it boosts your collagen can upwards of 300%. And we just
Wow.
don't see that in collagen supplements and some of these other
Mm.
things that are saying they're promoting collagen. So don't discount it just because it's a cream or it doesn't, it comes in a prescription tube and it doesn't look sexy. It is really, really
Right.
powerful. And you really could just do that in sunscreen and you are like 80, 90% of the way there. Now, I also say you got to look at what your skin needs. So people will say, well, how do you create your skincare habits? Like, what do I need to do? And it's hard for me to say what you need to do without really knowing what your skin needs. So that's sort of the first step. What kind of skin do you have? I have oily skin. It's
Mhm.
becoming more normal now, but do you have combination skin? Do you have dry skin? Do you have sensitive skin? So that's kind of the first key. And then what do you struggle with? Are you someone who gets acne? Or maybe you have eczema or psoriasis or rosacea, right? So
Right.
everyone's going to be a little bit different and you may have ingredients or skincare products that help with those conditions. And then I also say you have to pair your needs with your goals. What are your goals, right? Are you someone who is like, I will not pay a penny to do any sort of cosmetic aesthetic thing. I'm just going to age totally naturally. That's what my mom does and it works for her and that's what she wants and that's perfect. Um someone Other people are like, I want to try everything out there. I'm a maximalist, right? It's like
Right, right.
design. Are you a minimalist or maximalist?
Mhm.
Do you want to do everything? Do you want to try everything? You want to be the first to get this laser device, and that's fine too, right? And then I would say most people probably fall in the middle. I know I do, where I don't want to do everything. I don't want to be spending every waking moment thinking about how I look or my skin or what procedure I'm going to get, and it's expensive, right? But I want to help preserve what I have, and I want to look and feel vibrant for as long as possible. So you really have to balance your needs plus your goals, and that's really how you get your habits. So a few extras might be a vitamin C serum, especially if you struggle with hyperpigmentation or
Mhm.
melasma. That could be a great option in the morning. Something new that I've gotten really excited about is using an exosome serum. So that's
Sure.
something that I really think we're going to be hearing and seeing a lot more of this. And so I've started doing that. But really, that's it. That's my skincare regimen, and it really can be that simple. You don't need a separate hyaluronic acid and niacinamide and all these other
Mhm.
things because chances are they're already in what you're using. Go ahead and just like look at your bottle, actually look at what's in what you're using. A lot of times, these products that you're being marketed to are already in what you're using. So you don't need to go
Sure.
get a single use product.
Right. Well, those are some great tips. Quick question on the tretinoin. Is that something that you would recommend using every day for
Well,
anti-aging purposes, or would it be something that you use a couple times a week? And I noticed for myself, my skin runs on the drier side,
yeah,
that it tends to dry me out a little bit. So just
yeah.
curious what your
So
recommendation is.
I sort of treat to the point of just slight peeling for myself, and I
Okay.
consider that my exfoliation because I
There
know
you go.
some people really like to exfoliate. I don't, but I also am pretty rigorous with my tretinoin. But if you can tolerate it every day, then use it.
Mm.
Now, for people who have more sensitive or dry skin, if you're peeling in the morning, your skin feels cracked, then don't do it every day, right? And it may even fluctuate between times of year. So
Mhm.
if you live somewhere where it gets really cold in the winter and dry, your skin probably can't handle that. So you may want to just use it a couple times a week, and that's totally fine.
Mhm.
As you get older, as I've gotten older, I've noticed, okay, I can't use it every single night. I also can't use it every night on my neck. I get a little bit red. In fact, I'm looking at myself in the Zoom camera, and you can see I am a little bit red from using my tretinoin. The skin on my neck is thinner. And so, seeing this, I'm going to say, okay, you know what? Tonight, I'm not going to apply it on my neck. I'm just going to
Sure.
skip
It
tonight.
just looks like a little extra glow, Dr. Mina, that's all.
I mean, but to me, I don't really care if it's a little bit red, or
Mhm.
flaky. I joke like that's your exfoliation treat up to that point. But
Sure.
yeah, irritation is a big problem for tretinoin. A lot of people quit it before they see the results. The results are slow. I remember using it for a year, and then finally one day looking in the mirror and it clicked, and I was like, oh, I see what people are talking about. I felt like
Right.
I finally saw the benefit in my skin, but I swear it took a year. So I usually will tell people it's like exercise, right? When you first go to the gym, those first
Mhm.
sessions, they're horrible. They're terrible. You feel awful. You feel like you can't do anything. Your muscles are sore. They hurt the next day. It's not fun, right? But we don't give up. You keep going. And then in a month or two, you're like, wow, I can't believe I had a hard time with those weights because now I can go even stronger. So
Sure.
I would just encourage people to stick with it. Don't use a lot. Start at a low concentration or even over the counter, and then build up to it. And if you can't do it every night, that's totally fine. Just do it
Mhm.
a handful of nights a week. And then don't be afraid to use a moisturizer on top of it. The sandwich technique you could
Mhm.
do moisturizer, tretinoin, and then you can even do another moisturizer if you need to. So there are lots of ways to play around with it. Avoid areas that are a little red or itchy or dry.
Mhm.
Um, but if you can, I would say if you can, it's really such a cost effective way to keep your skin looking amazing.
Thank you for that tip. I definitely think that the tretinoin trend has been going for a while, but I see that even for my patients that we're doing microneedling for and facial acupuncture, that we need to have them discontinue it for a little bit while we're
Yeah.
treating, and then
Yeah.
start back up after their skin's kind of healed and reset
Yeah.
from our treatments.
Mhm.
So this is kind of something that I get a lot of questions about in my practice, and one of the things is, as we age, what can we do in our 40s and 50s and beyond to adapt our skincare routine besides some of the topical things? What are some of the more safer? And I'm also going to say this because a lot of my audience, they're fertility patients, right? And they're
Yeah.
going through a fertility journey. What are some of the things that can be incorporated to maintain and improve your skin that are still fertility safe? Or pregnancy
Mhm.
safe, I should say,
Yeah,
too.
yeah, pregnancy safe. Yeah, so
Mhm.
that can feel like a bummer, right? When you're well, I shouldn't say that. Uh there are definitely some things you wanna avoid when you're pregnant, and there are things that are safe, and I do find when people are pregnant, a lot of times the go-to easy answer is just to say no, and I feel
Sure.
like pregnant women get told no or all the time because
Absolutely.
people just don't wanna take the risk to find out if it's safe or if God forbid anything would happen, right? So I feel like we just tell pregnant women no all the time, and it's not really fair because is a big chunk of your life. Or if you're going through fertility treatments, to say, okay, well, just don't do any of this for the next year.
Mhm.
But things to stop. So we certainly want to stop any really strong vitamin A creams like tazarotene, Tazarac. That one is pregnancy category X. Tretinoin, it's unclear. We don't really have data to say it is safe or it isn't safe. So really, the dermatologist stance is just stop it. It's safest to stop it if you are actively trying to conceive or you are pregnant. Um, you could use over the counter if you like retinols, but we just don't have enough data to say whether it's safe or not. Um, Botox, same thing. people have been treated with Botox when they're pregnant, but certainly not for cosmetic things. So I would never knowingly give someone who is pregnant Botox. It's just not
Mhm.
worth the risk. We don't really know. And the thing with pregnancy is no one's going to do a study on whether with a group of pregnant women and non-pregnant women and give them the same
Sure.
thing. It's just not safe. So a lot of times we just sort of have to say we don't know, but if it's for cosmetic, it's really not worth the risk of
Mhm.
your fetus. So the good news is when you're nursing, you can do both of those. So that's some good news. You don't have to prolong that if you're nursing, so you can
That's
go
good to
back to
know.
that. Yeah,
Mm.
but there are other things you can do. That things like microneedling are completely safe. You could do laser treatments. I think in general, a lot of dermatologists, the thought is to avoid unnecessary or elective things during that first trimester. But
Mhm.
typically after that, like I'll even try to postpone surgery on someone until they're through that first trimester because there are just so many variables and things going on. Um, but certainly lasers could be safe. I'm trying to think what else someone might want. I would maybe caution against getting any vascular or laser treatments during pregnancy simply
Mhm.
because your intravascular blood and space is increasing. And so I know for myself personally, I felt like I noticed more little blood vessels on my skin. And rather than going and zapping them, I just waited. I had my kids and then they went away. So you may find that some of these things go away on their own rather than having to go spend money on it. Um, I wouldn't do anything like sclerotherapy. We're actually
Mhm.
injecting into veins during this time
Sure.
as well.
What
But
about
if
what
uh
about like an IPL treatment?
yeah, that would be totally fine. Totally fine. Yeah.
Okay. Good to
Now,
know.
especially if you're struggling with things like, maybe melasma, that could be an issue
Mhm.
for women when they're pregnant because of the increased hormones. So I would say if you are struggling with melasma, just make sure you're being really diligent with sun protection, maybe even using a mineral based or tinted sunscreen to also help with any visible light that might be worsening the melasma as well. But for a lot of women, once they have the baby, the melasma does get better. So again, I wouldn't necessarily invest a ton of money into these treatments during
Sure.
pregnancy because a lot of it may improve on its own.
Well, that's a really good reminder because I think a lot of patients things change and they focus on what's in front of them while they're pregnant, but like you mentioned, a lot of things go away on their own.
Yeah.
And I remember myself being pregnant and complaining about melasma, and my
Yeah.
OB said, just wait till after you have the baby. And if it's
Yeah.
still bothering you, you can go back and get some treatments from your dermatologist.
Yep. And
So,
did it. Oh, and speaking of melasma,
mhm.
hydroquinone is a big no-no if you're pregnant.
Hydroquinone. Yes, yeah.
Which is in a lot of
Mhm.
lightening agents.
Sure.
So you just want to make sure that any lightening agent that you're using doesn't have hydroquinone.
Right. Read your labels.
Yeah.
It
Yeah, I
is the
think
lightning
during
skin products.
pregnancy kind of less is more if it's not
Mhm.
if it's totally elective and not really necessary, just maybe think twice about it. Like filler, there's really no harm in doing filler when you're pregnant. But again, you are most likely gaining weight. Your face may be fuller.
Mhm.
So again, I wouldn't recommend getting filler if your face is not really what it's normally at baseline,
Right, right.
because then once you have the child, like it might look, how are things going to settle out? So again, I think that
Right.
in general, anything elective like that, I would try to postpone, but
Mhm.
it's not that it's unsafe to the baby. It's just may not give you the best results.
Yeah, and you're going to have a new normal. After you have your
Exactly.
baby, you're going to have a
Yes,
new normal, your
you
face and your
sure do.
body, right?
Absolutely. Your life, your life.
Yes, for sure. So, how does the decline of our hormones as we transition, from being childbearing age to perimenopause and menopause impact our skin? And,
Yeah,
why do these changes occur? I know that there's a lot of hype around using bioidentical hormones to help with skin elasticity. So this was kind of a question that came up quite a bit with some of my patients that are going through the transition of perimenopause into menopause.
Yeah, right. It's I was just talking with a hormone specialist or urologist yesterday about this whole concept of hormone balancing. We hear that
Hmm.
all the time. Are your hormones in balance? And the thing is, as women, our hormones are almost never balanced. The only time they're really balanced is when they're zero. And that's when you're
Hmm.
postmenopausal and all your estrogen is gone. And in fact, your spouse, you're like men have more estrogen than women during in the postmenopausal period, which
That's
just blew my
crazy.
mind. I could not believe
Mhm.
that my husband will ultimately have more estrogen than me one day. But so this concept that your hormones are they in balance? So with women, you know our menstrual cycle, right? Every month our hormones are in flux. They're rising then falling, and that can wreak havoc in the skin. Perimenopause as well, the hormones, sometimes they're high, sometimes they're low as the body's preparing to go into menopause where we stop ovulating and producing estrogen. And it seems like the skin and the hair are very sensitive to these shifts, especially dramatic shifts in our hormones. And some people seem to be more sensitive to these hormones than others. So some people are more sensitive to testosterone being converted to DHT, which can cause acne, right?
Mm.
So some people tend to get that acne along the jawline, and really you can get acne at all ages, which is kind of a little bit of a bummer to hear. So it kind of depends on your own genetics. How susceptible are you to testosterone, and how and your estrogen levels too? If you're more prone to, and I think women sort of innately know this, right? Like some women are more sensitive to when their period is coming and how they feel versus others are like, oh, I don't even really notice it. So our hormones are going, they're totally not in balance. They're all over the place. And there's really, I hate to say there's nothing we can do, but until menopause hits, there really isn't anything we can do about our hormones other than just trying to lead as healthy a life as possible. So, don't discredit taking care of yourself, having stress management, sleep, right? Getting a great night's sleep, prioritizing sleep, which I think is very hard for moms. It was very hard for me to prioritize
Mhm.
sleep, but something I'm working on. Exercise, moving our bodies, doing resistance training, all of these things will help because I sort of say it's self preservation. We know menopause is coming. If you live long enough, it's going to come. And yes, it's natural. This is what happens. But what's kind of unnatural is how long we live after menopause. We have been able to keep ourselves alive for longer and longer. I mean, we're gonna if you look at the population, right? We're living so much longer than ever before, and we're projected to continue to live longer. So that's where the challenge is. Women have never lived this long in the postmenopausal state than ever before. And so that's sort of a new area to navigate. But for me, I see it as prevention number one. That's always the best, right? And then maintenance. So maintaining my health for as long as possible, even through these transitions that are coming of perimenopause and menopause. Um,
Mhm.
and just trying to be as healthy as I can now, because build up as much muscle as I can now because I know it is going to decline. Same thing with my collagen, boosting my collagen, keeping my skin as healthy as possible now because I know when my estrogen levels drop, I'm going to see a precipitous drop in my collagen. And so I know that's coming. So I'm like putting money in the bank, right? And because I know I'm going to need to take out a withdrawal. So I'm trying to put as much money in it now when I can.
Right. So I think that's a good point too, is to start earlier. And
Yeah.
like anything else, when we're looking at diet and nutrition and supplements, a lot of these things are preventative medicine. And so same with our
Yes.
skin. In Orange County, where I practice, bioidentical hormones are very common as a form of HRT. So I'm curious to know what your thoughts are on HRT therapy and how it can impact our skin health, and
Yeah.
if it's a good option and if it's something to consider, especially if you're perimenopausal and your estrogen is starting to decline. You're seeing
Mhm.
that your hormones are declining, your cycles are becoming more irregular. So,
Yeah. Well, so I am not a hormone expert or OBGYN or urologist. So
mhm,
I would say talk. I'm a big fan of them, right? I've seen the data showing
mhm,
that it can it's more than just vanity, that it really it prolongs life. And a healthy life decreases the risk of diabetes, lowers your chance of dementia, heart disease, all of these things that that we will have to live with postmenopause as as postmenopausal women, right? When our estrogen
sure.
levels are below our husbands. But so I'm a fan of it. I'm certainly going to talk to my doctor when the time comes. And
Mhm,
I think there's so much good data showing the benefit and safety of it. It's too bad that back in the early 2000s there was a flawed study
right.
that really made women scared, and then also a lot of physicians never wrote it, and then they never trained the younger doctors coming up to write it. And so uh, um, we have this whole group of women who haven't had the benefits of being on it. And then we also have these doctors who never learned that it was safe or okay to prescribe it. I do feel like that's shifting and turning, but if you're interested in being on hormone replacement therapy, I would talk to, I think the Menopause Society has a website you can go to. You can call around and you can kind of just over the phone ask, and get a sense of whether this physician prescribes it or not. Because if someone tells you, "Oh no, that's not safe. You shouldn't be on it. You can't be on it," I would probably find someone else
A
or
second
find
opinion.
exactly, find
Mhm,
someone who's more up to date with the literature and knows about this. And another thing that kind of surprised me is I thought all GYNs, all knew about all of this, but really
sure.
that this is just speaking more to like our medical training. I feel like at least in medical school, I learned about the reproductive cycle. I learned how to prescribe birth control pills, but we never learned anything, at least I didn't, beyond that. It was almost like we can study their reproductive life cycle, but then after that, like there was no more information. Now, yes, I didn't go on and do a residency, but my friends who are OBGYNs will sort of echo the same thing, that just there's such a disproportionate amount of training that goes into that portion of a woman's life. And as we now are living so much longer, and we're going to have people like us who are going to hopefully live to be 90, 100, that's a
Yes.
big chunk of time to live
Mhm,
postmenopausal. So anyways, back to what you really were asking me. But yeah, so I think hormone replacement therapy is wonderful. I think it's wonderful for women to have this, and it can help with so many things. We need more studies to show how it affects skin, but the thought is that by using it, you can maybe mitigate some of these changes that happen, like the decreased collagen and
mhm,
elastin. We're not going to totally stop aging just because you're on hormone replacement therapy, and we do need studies to actually show this. But it's conceivable. It seems to make sense that if it's helping all these other organ systems, why wouldn't it also help the skin? Now, one
sure.
thing that people are really excited about, at least in the derm world, that I do prescribe is topical estrogen, and
Mhm,
this is a great option. I mean, GYNs have been prescribing this for vaginal dryness. The skin of the perineum and vagina gets thin, dry, pain with sex, increased urinary tract infections. And it's really been a game changer. And so you can sort of think of it as women have been putting it on their faces, right? As
sure.
well, or their hands and necks. And I feel like I'm seeing an interest in that again. And now I'm seeing actually skincare specific estrogen, because maybe you don't want to put a big tub of vaginal estrogen on your counter, but you don't mind putting, putting a
Right.
bottle that just says, estrogen cream.
Sure.
So,
Something a little
so
more
that
generic.
exactly,
Yes.
exactly. So I do find I'm getting asked, and I will prescribe it to people. Estrogen cream on the face. We know it's very safe when used in the genital area. No systemic absorption. So even if you
Great.
don't want systemic hormone replacement therapy. Certainly, you could use topical as well. And we need the studies to show how it impacts the skin,
Well,
but
on an anecdotal level and just kind of on a visual level, what kind of results are you seeing? Do you see
yeah,
improvements?
absolutely. So improvements, patients love it. It's kind of replaced their moisturizer. It becomes their moisturizer.
Mhm.
And the other benefit is that it has estrogen in it. Another thing we haven't talked about, we've been talking about skin, but hair. So I don't know
Yes,
if you hear this from your patients, but hair loss is big. And I'm even
absolutely, all the
noticing it a
time.
little bit in
Mhm.
my 40s, right? Um, and it can be really profound. Like I just saw a lady today who was postmenopausal and incredibly thin hair, and this can be really emotionally and psychologically um, traumatizing for women to lose their hair. It feels like we're losing our femininity, but with the drop in estrogen, we can see a good bit of hair thinning almost universally in women, and it's a big issue. And so the question is, will being on hormone replacement therapy help with that? And so again, we need more data, but it makes sense, right? Like if estrogen keeps our hair nice and thick and beautiful, then when it
Mhm.
drops, and it's no longer that way, could we replace it? So I think
Absolutely. For your
more,
skin, face, and your hair. It's
yep, absolutely. Yeah,
see.
estrogen's so important for all of
Mhm.
this.
Right. So this is great information, and I do see products myself too when I'm reading through the ingredients that some of them are now having a little bit of estrogen added to it.
Mhm.
So I would imagine that kind of like tretinoin, it might take some time to see the results,
Well,
and
yeah,
you
that's with all
mentioned.
skin stuff too, right?
Hmm.
It I would just tell people that's one thing I see a lot is people quit before really giving it a chance. So it's like working out at the gym, right? You want to see the results after eating a salad for 3 days, but you gotta
Right.
you gotta stick with it a little
Patience and
longer.
perseverance, right?
Exactly, exactly. Consistency, sticking with it. And I know it's hard, but it really makes a difference.
So, Dr. Mina, I'm just curious of what your thoughts are on mental health, stress, anxiety, and how what's its role that it plays in your skin health and how people can manage that connection. And obviously, when you have a lot of stress and anxiety, it impacts your sleep.
Oh
And so,
gosh, yeah.
insomnia is usually a big issue with stress and anxiety. So, I'm wondering what you see in your practice and with your patients.
Yeah. So again, this goes back to if 80% of getting your skin healthy and beautiful is taking care of your body. And then you can come see me for the last like ten to 20% if needed,
Hmm.
right? And sleep is so powerful. I used to think it was a waste of time, and I would almost like pride myself on how little sleep I would get, which is so crazy. And now I realize like this is so important. It's like my superpower because when I have a good night's sleep, I feel good, I eat
Mm,
better, I can exercise, I'm just mentally more clear. And so sleep's so important. And I feel like we're finally giving it the respect it deserves and not just boasting over how little we can get by on. So sleep is super important and stress. Yeah, I'm actually giving a talk on stress in the skin in a couple of days because I get this a
wonderful.
lot too.
Mhm.
So we hear a lot about like stress and inflammation in our bodies, but stress is the or I'm sorry, increased inflammation is the response to stress. And that
Mhm.
stress could be from a tiger about to eat you, like back in the day, or it could be this more chronic stress that we all live with of deadlines and all our to-dos and just the busy lives that we have and all the things we're trying to do and juggle and family and career and everything. And this chronic stress, it never lets up. And a little bit of stress is good, right? It motivates you. It helps you become successful. But this chronic stress that's really unrelenting is really terrible. Cortisol levels are increased. We tend to not sleep well. We tend to not eat well. Again, that causes more inflammation in our guts. And we know that there's a strong connection between our skin and our gut and even our brain. that these are all
Mhm.
connected. They're not just separate pieces. And so when you're stressed out, high cortisol levels increase sebum or oil production, which is why a lot of people notice they break out when they're stressed out.
Sure.
Right, and, like, the last thing you need when you're stressed out is a big pimple, right? But that happens, probably also from not eating as well, maybe eating more processed foods, sugars, we
Mm.
know can exacerbate that. So again, it's easier than it's easy to say, "Oh, just manage your stress," right? Like, fix it and make it better. But this is where really learning that self-care is important, and it's not being selfish, and finding things that you love that help you relax, that help you decompress, whatever it is. Maybe like I love massages. Like I'll get a massage as much as I can all the time. To me, I love that. I love yoga. Sometimes just being outside can help me. Getting off your phone, right? That's a huge level
Right.
of stress, at least for
Mhm.
me, and it's always there. And that's another thing too. I find like we're seeing these images of people that aren't realistic, and we think, and then we get depressed that we don't look like that, and why they look flawless and perfect, and their highlight reels of their life look amazing, and yours doesn't. I hear that and I see that a lot, and I feel it myself, right? Um, so I think that feeds into this self-criticism we have, and then we feel like we have to fix it, and then we feel like, we're unattractive, we're unworthy, and then we start chasing all these things to make it better. Um, yeah, I mean, stress plays a huge role in our skin, and really trying to find ways to be calm and present and all that. It won't, I mean, do it for your skin, but it's going to help everything, right?
Absolutely. And thank you for speaking to that because I think in our practice, we really talk a lot about cortisol regulation, adrenal fatigue, and really getting out of that survival state. And,
Yeah,
we want to thrive, not just survive. So
exactly.
being able to get out of that constant stress mode, you have to make a conscious effort to do that.
Oh, for sure,
You know,
because
it's
yeah, it's so easy to drift back into it. You're like, "Oh my gosh,
Mhm.
why am my heart racing and
You're
I feel
right.
like chest pain." Um,
Yes. Feelings of
yeah.
anxiety. Why am I waking up in the middle of the night and not able to go back to sleep?
Mhm.
So I think that that's, like you said, beyond skin health, just your overall well being is so important to
Yep.
really manage your stress and take care of yourself and do those self care things, whether it's acupuncture, massage, facials, whatever it is,
Right. Well,
hiking,
and
yoga.
I'll find too, like people will come to me wanting me to fix something, and they think that that's, if only I didn't have these bags or the
Sure.
jowling or whatever. But
Mhm.
really, even when that gets fixed, or usually they look beautiful anyways already, um, I realize like I can't, what they're seeing, I can't fix. It's something deeper and more internal. And so it's best, just you're going to spend a lot of money and you're not going to get the results you want, because that's not really the problem, right? But we fixate on it like it is, but it's
Right.
actually not that forehead crease. It's actually something deeper.
Absolutely. And getting to that root cause, and everybody has a different journey, right? So
Yeah.
when they're willing to look at that, sometimes it might just be looking at the branch and some of the symptoms. And then eventually, hopefully, they'll be ready to take a deeper dive and really look at the root cause of their
Mhm.
stress and some of their fine lines, right? That may be
Right,
causing
right.
those fine lines.
Yeah, it's kinda like this vicious circle, right?
Mhm.
And
Definitely.
it's hard to stop. It is hard. It's a I don't have it figured out either, right? I'm also, like, working on all this.
Sure. Well, and you're such a great role model for your patients to be able to say, like, hey, I don't have it all figured out either. And
Yeah.
it's kind of like every stage of life, we're getting thrown different challenges and we're just
Oh,
kind of
yeah.
learning as we go.
Yep.
So, Dr. Mina, you have been amazing and so informative. Thank you so much for sharing all of your knowledge. If you had a couple of things for like key takeaways for our listeners, what would be your top few things to share?
Well, I would say, we kinda talked about some of these, but, like, being consistent, Don't be jumping around, trying different things all the time. I know
Mm.
it's hard, right? Like I get the Instagram feed stuff too. And I'm like, well, maybe I should try this. Like they look amazing. Um, I think when you jump around, you're not giving products time to actually work.
Mhm.
Um, don't be afraid to really pare back. You don't need 10 steps. You don't need to spend hundreds of dollars on your skincare products. It really can be simple. I talk about like getting off the hot girl hamster wheel and that
I
we
love that
start
saying. I
it
love that.
starts out really like innocent in your 20s. You do some like mani pedis and then maybe start doing some Botox and then some filler and then some laser and microneedling and waxing and it's just like it keeps going and the older you get you're like, oh well, now I got to worry about my elbows, oh now I got to worry about my ankles, and like all these body parts we're telling women to be insecure about and
Ugh,
worry about. And I mean, like, I'll see it I'm at the gym and I'm like, oh my gosh, my elbows are wrinkly, like, but at some point it's like not everything has to be stamped out. I don't necessarily have to have elbows that look like I did when I was in my 20s. That
sure.
it's okay for things to look different. It's
Mhm.
okay to not look like you did when you're 25. You can still be beautiful. You can still be attractive. It just may look a little bit different. And it doesn't mean that that's bad. And I think we go too far, and that's when you become bizarre looking, right? Where you take it too far. You're trying
Yes.
to make it look like you've never aged at all, and then you don't even look like yourself. And I don't think people really mean for that to happen. I think they just become so fixated on fixing the next problem that they forget
Mhm.
about sort of the overall global look. And so I think just also allowing women to age. Like my husband doesn't sit in front of the mirror and stress out about every little wrinkle and ounce of fat. So I think we're as women we're just way too critical on ourselves. And I at least what I'm trying to teach myself and model is just a healthy acceptance of aging and just really focusing on strength and vitality and preservation and being as healthy as I can be now at 44 and looking as good as I can now at 44, even if that is different than what it looked like 10 or 20 years ago.
Thank you so much for sharing that. That is perfect. And this is all about the concept of pro-aging, right?
Yeah.
Versus anti-aging and
Yeah,
graceful
yeah.
aging
Yep.
and just accepting ourselves. And we can gracefully age and still be beautiful
That's
in
right.
our
And yeah,
40s,
it's
50s,
not.
and 60s and beyond.
Yeah, exactly. And it sometimes feels well, I forget who said that. I didn't say it, but the best way to look great in your 50s or 60s is to wear sunscreen in your 20s, right? Like prevention and
Mhm,
and
mhm.
and maintenance and being as healthy as strong as you can. And really that people have like a look, a glow about them when they feel good about themselves, they have confidence. And we've all seen it in people, right? Where you're like, wow, that person is just so attractive or so beautiful. Maybe not
Mhm.
in the classic way, but there's just something about them that is so intriguing. And
Right.
I
They're
want
just
that to be
radiating.
me. Yeah.
Yeah, absolutely. Okay, 2 more questions.
Yes.
So, any special diets or foods that you recommend
Well,
for
so here's
beautiful
here's the
skin?
thing, and again, I'm not a nutritionist, so again, I'm a dermatologist, but for 20 some years, I was a vegetarian. I even dabbled in veganism. I was big into
Mhm.
animals and all that, but I realized I was craving meat and protein, and I finally listened to my body about a year ago, and I started eating meat again. And the decision for me was to eat meat because I was trying to eat a lot of imitation meat, and I felt like
Mhm.
why am I eating something to imitate when I could just look for humanely raised and everything?
Mhm.
So for me,
Mhm.
I needed more protein. My body was telling me it had never said that before. Even during pregnancy, I'd never felt like I needed meat. And so I started eating more protein. And I think that's something as women, at least for me, I was so focused on like calorie restricting my diet when I
Yeah.
was younger and focused on like a number on a scale and being skinny, but now I'm less worried about that number and I'm thinking more about muscle protein is key for that,
Hmm.
building muscle resistance training. And the other thing I say about diet is I tend to recommend a Mediterranean based diet, plant forward, lots of fruits and veggies, fiber. That's something we miss out a lot in our Western diet. Um, I drink, I have wine a few times a week. I like
Hmm.
some sweet things. So I think in moderation, right? I want to enjoy my life. I don't want to be so restrictive that I can never eat this food group and I can never touch bread. Like I want to enjoy my life
Right,
because
right.
that's important to me too. But I think the Mediterranean diet has been shown to be really beneficial for skin, high in lean proteins. And I would just say, like, the food you eat, it should look like where the food it is, right? A carrot should resemble a carrot. It shouldn't be, so mushed up that you can't even tell like where it came from, right? And I try to cook at home as much as I can rather than eating out. I know it's hard, but yeah, I think just and again, just making little changes now make big differences down the road. And I would say just the one thing for listeners, maybe just look at the processed sugar. We do know that that really affects your skin. It breaks down
Hmm.
your collagen. It increases inflammation. It can flare acne. So there's so much sugar and stuff you don't wouldn't even think there's sugar in it.
That's right. It's
So
omnipresent now.
it really is. It's
Hmm.
crazy because I used to think, well, I don't eat a lot of sugar. And then I actually started looking at every single thing I put in my mouth. And I was like, oh my gosh, like 20 grams of sugar in this.
Hmm.
So I would say that'd be important. And then not being so calorie restricted because then and not eliminating total food groups because your skin will show. I mean, people have nutritional deficiencies. Usually it's in not in sort of Western cultures, right? Where we almost have like overabundance. But there are people who are so restrictive or their diet is very restrictive and their hair will break and brittle, their skin will be dry, or they totally like minimize the fat in their diet. So I would just say not to be afraid of fat, not to be afraid of eating,
Hmm.
but to focus like a Mediterranean diet.
And moderation.
Moderation, exactly. Yeah,
Moderation.
yeah, like wine, don't have 1 or 2 glasses a night, like, maybe just have it a couple nights a week or,
Hmm.
if you're gonna have a dessert, like, for me, if I'm gonna have a dessert, it's gonna be a really good dessert. It's not gonna be from the
Got to
vending
be
machine.
worth it.
It's gotta be worth it.
Right. Agreed. I feel the same
Yeah.
way. Okay, last question, Dr. Mina. Any upcoming talks or events that you would like to share about?
Well, let's see, I don't when is this gonna air?
I'm thinking in February.
Oh, okay, okay.
Mhm.
Um, so that will have passed. Well, I don't not that I have off the top of my head. But I
Okay,
can share
mhm,
a lead magnet if you'd like, an email I have for or a PDF I have for people, if they'd
that would be
like to
wonderful.
well, I like doing little quizzes. Maybe I'm just a dork, but if you're curious
Love
on whether
that.
you're like a true skin minimalist or you are like a skin maximalist or somewhere you want to know where you fall in between, I have a fun quiz you can take at theskinreel.com/style where you can learn about your skincare style.
Perfect. And I'll include that in the show notes too.
Awesome.
So grateful for your time, Dr. Mina. Thank you
Thank
again. And yes, so excited to have this air in February. All right.
Awesome. Love it. Thanks so much.
Thank you.